Hi, and welcome to the HPD research poster sessions for EuroSense. My name is Michelle Nigella, VP of Research and Innovation at HPD Research. And we actually had a lot of posters for EuroSense this year, 5 different posters. We had brand harmony, DIY consumer neuroscience tools, Max Implicit for consumer technical models, behavioral approaches for innovation, and a mood mapping methodology for comparing marketing versus the product experience using neuroscience. So the thing about having too many posters is that it can get really difficult to interact on all of them at the same time on a virtual conference platform. There's also no chat box for these messages, so it was hard to interact with people who were visiting. And my understanding is that some people were having some difficulty downloading the posters. So if you missed our session or had any trouble getting in contact with myself or downloading the posters, you can still find us by visiting our website at www.hcdi.net. You can tweet with us at HCD Neuroscience. You can link with us on LinkedIn. You can catch our YouTube channel, or you can email me directly at michelle.nigella@hcdi.net. In this poster, we're looking at using behavioral science and other innovations to improve consumer research. It's a case study of a DIY approach that goes wrong. The key takeaway to this study is that in-house neuro labs are possible with really great research benefits, but it's definitely also a case of buyer beware. So I'm going to start off with talking about what is neuromarketing. And personally, I really don't like the word neuromarketing. It comes with a bad connotation of maybe somebody's trying to sell you something. So I prefer the name consumer neuroscience or applied consumer neuroscience, but it's also been known as System 1 research or behavioral science. And it's really how the knowledge of esoteric academic research has been used to sort of understand interactions that consumers have with products and different types of communication. But it can be a really huge leap. Neuromarketing or consumer neuroscience uses a lot of different tools. There's a lot of different approaches you can do to basically measure the physiological responses that people have to different experiences and see how that applies to consumer research. And all of these tools are off the shelf, meaning that you don't need any special license or academic degree in order to buy any of them. As long as you have the money, you can purchase any one of the tools using consumer neuroscience and use them and interpret them however you please. But that doesn't necessarily make it right. For example, if you have $3 million, you can certainly go out and buy an fMRI machine. You can also go the cheaper route and use something like online facial coding. And while it could be a really useful tool, it can also be highly misused or really easily misinterpreted. So I'm going to talk about a case study now where a particular CPG client came to us because they had purchased a neuromarketing package lab from a provider who promised them that they could use these tools to answer any number of research questions that they might have. In particular, they were interested in doing consumer sensory research, package testing, and being able to do claims exploration. The neuromarketing provider sold them a set of tools that they could use to cover all of these, assuming that one hammer could hit all of these nails. They were sold that they could use physiological measures like GSR or galvanic skin response and heart rate, which are biometrics. They were also sold a facial coding platform and an eye tracker. However, when they started to use these tools, problems arose very quickly. It was clear that they needed to make sure they were using the right tool for the right question, and this just simply wasn't the case. For example, they were using PPG for heart rate, but they were interpreting the results as though it were HRV or heart rate variability. Unfortunately, PPG is not very appropriate for HRV, so it didn't really work out. The eye tracking that they used, they were hoping to be able to use it for pupil dilation, to be able to measure arousal, which also didn't make a lot of sense because they already had GSR, which is a very reliable measure of arousal. But they were told they could use their eye tracking device for this anyway, even though the device itself was only 30 hertz. In order to get proper pupil dilation measure, you really need 60 hertz. So obviously, they weren't really using the right tool for the right questions. Another issue was that they needed to make sure that they were doing proper experimental design when using these sort of advanced tools. And there arose a big problem in that there really wasn't any specialized experimental design for the physiology. When you're using a physiological measure, you have to make sure that the stimuli are very specifically timed and marked in the data set. Additionally, they didn't have any controls for any experimental noise, meaning the noise that was around the participant when they are being measured, or maybe what else was going on in the room. There's also no consideration of any order effects, which can be a really big deal when you're thinking about physiological measures. It was also very clear that they weren't explaining the limitations of the tools they were sold. So being untrained in the data export, they didn't have the correct data to even use for the analyses. And they were unaware of the issues of using certain tools in being able to measure the experiences they were hoping to measure. So for example, the facial coding and the problems they were having in using it for sensory research. This made it really difficult for any of the interpretations they were hoping to make. And the moral of this story is that first and foremost, you need to make sure that you're using the right tool for the right question. It's also important to realize that there are no bad measures. It wasn't the fault of these tools. It was just that they had made bad measurements with the tools. You need to be really careful about anybody you're buying something from, because if you go to a widget salesman, he's only going to sell you a widget, and he's not going to tell you that the widget can't do what you want it to do. So you have to make sure that you're not looking at a widget salesman or snake oil promises. It's also important to make sure that the tools that you're buying have good validation. Really ask the questions to make sure that you understand the results that are being sold to you. I do want to note that it is possible to build a successful in-house neuro lab. It can be used for media and marketing research, and it can be used for product research as well. When you build your own lab and you don't always rely on external partners, you can actually have a lot of cost efficiencies and higher throughput of your research. It can give you a lot more flexibility and a lot faster insights as well. But how do you do it properly? Well, I really do think it is important to make sure that you do partner with an expert to get the right training and also keep it up to date. So it's an ongoing process. The tools themselves are going to become fancier and grow over time. But it's also important to make sure that you're using the right analyses for the different types of research design. So in a lot of cases, you might just want to outsource those analytics. If you have any other questions, please feel free to reach out to me, Michelle Nagella. You can contact me via email, michelle.nagella@hcdi.net.